My name is Suzie Webb, and I am the Administrative Operations Manager here at Heartland Cares. And one of the areas that is in my department is the prevention team. We have actually a team of one at the moment. And what we do in the prevention area is testing and education for people out in the community who are at risk for, contracting HIV. We do testing in some of the drug courts in our area, in rehabilitation centers, and then in a lot of just public groups. The key to, preventing HIV from spreading is to test people and get them into prevention early. The earlier that we can get them into care here at Heartland Cares and prevent spreading of the disease to others. So to get tested for HIV, it's a very simple test. We do walk-in testing here at the clinic, and then also at several of our events, and like I said, within drug courts and rehabilitation centers and that sort of thing. But testing is very simple. It is free, it is confidential, and it is very quick. It takes about 15 minutes from start to finish. So when you come in for testing, it's a simple finger prick. They just use it's a little needle similar to what you would use for diabetic testing. And they prick your finger, take a little bit of blood, and wait for it to react one way or the other. And then during the time while you're waiting for the test to come back, we would do some counseling, some questions, kind of determine your risky behaviors, and then talk about ways that you can go about either changing those behaviors or recognizing those behaviors, or even doing some things that would be a little bit safer to yourself and to others that you are involved with. So we go about just kind of talking to you about some of the things that are going on in your life and what brought you to either our clinic or one of the other settings to get tested. If the test comes back to be reactive or positive to the antibodies for HIV, then we would do a confirmatory test, and that's just a secondary test that we do. It's a mouth swab, and it takes about another 20 minutes for that one to come back. And then once that, confirms that the test is positive, there are some other things that would come about then. We would, if possible, go ahead and get you, after that, they would do a blood test and send that one off. And that one takes several weeks to come back, but we would go ahead and get you introduced to our doctors, do some medical history, get your records, do some other things, and just go ahead and get you into care here at Heartland Cares.